A 2-week vector control exercise is underway to fight Singapore's dengue outbreak. The island-wide effort comes as the number of infections has surged to more than 20,000 so far this year. That's more than the annual total in previous years, except for 2013.
So why have cases shot up? One reason is the prevalence of the less common DEN V3 dengue serotype this year, which fewer people have immunity to. Another factor is a spike in mosquito breeding at construction sites and homes in April and May during the circuit breaker.
So joining us to discuss this outbreak and what's being done to fight it is Dr Leong Hoe Nam, infectious diseases specialist at the Rophi Clinic at Mount Elizabeth Novena Hospital. Welcome back, Dr Leong. With more than 20,000 cases already reported this year, do you think the outbreak can be brought under control anytime soon?
Honestly, it's going to be really challenging. If you think about it, all this is about the mosquito biting someone. And if we try to curb and control the mosquitoes, they are already ahead of us easily by 2 to 4 weeks. So whatever we do now, whatever we intervene now, is going to show its effect 1 month later. So whatever it is, we are 1 month behind. And we are going into the traditional high peak season of dengue, which is July, August. So unfortunately, we're going to see big numbers. As you rightly pointed out, we have building sites. At the same time, we have a seasonal variation. Every 3 to 5 years, you get a big peak, and it is time for the big peak again this year. I think one other consideration is our work from home. COVID-19 actually has restricted us from going out to work, which means many people are staying back at home. And for the mosquitoes, this is heaven galore because they end up feeding on many people. With a full belly of blood, these mosquitoes will end up laying a lot more eggs and in turn propagate the cases further. The more dengue cases that are out in the community, the easier it is for an uninfected mosquito to find one and in turn spread on. The season, the temperatures, the uncontrolled breedings at home as well as the building sites, the new dengue 3, and unfortunately working from home. All these factors have come as a perfect storm to deal with us another bad blow of dengue this year.
Doctor, as you rightly mentioned that due to COVID-19 measures, people are more cooped up at home. So what should the first lines of defense be then to avoid getting bitten by mosquitoes?
To understand that the only way to get dengue is actually through a mosquito bite. If we can prevent the mosquito bite, we'll prevent any form of transmission. So mosquitoes are day biters. They bite very well at the early part of the day, at the end of the day. So those are the times you need to watch out for. Be careful that the mosquitoes will fly into the house. You don't even need to walk out of the house. So if in your own house, if you can, and you have the luxury of doing so, close the windows, switch on the air conditioning, which I don't think is very green. The alternative is actually get nettings around the windows so that you allow the air to come in, but not the mosquitoes. This way you protect your family and in turn prevent the dengue epidemic from getting worse. Number 3, even consider dengue repellents. Dengue repellents which you can apply on yourself, such as the DEET, which is endorsed by WHO, or using on mosquito coils or other forms of mosquito repellents or even mosquito traps. Get rid of the mosquitoes and you get rid of dengue. For the individual, for those who actually have had dengue before, there's one additional aspect you can consider is getting the dengue vaccine. The dengue vaccine is very helpful in those who have had the infection before. If you haven't had the infection, taking the dengue vaccine may not help you. So if you had the infection before, go for the dengue vaccine and you can get yourself protected against the next dengue attack.
Well, thank you so much, Dr. Leong, for sharing the tips and advice, to ensure that you keep safe from getting infected by dengue. Now, we've been speaking with Dr. Leong Hoe Nam, infectious diseases specialist at the Rophi Clinic.